During this week's discussion, we discussed behavioral systems analysis. Behavioral systems analysis is a concept that blends ABA in the organizational setting that looks at how to use ABA to help shape processes and organizational change. And behavioral systems management looks at three different areas: so organizational, processes, and then individual performer. One thing, Professor, that you mentioned is that when looking at these processes, we have to understand that one change in a process will likely impact the entire process. So if one process changes, this may impact performer behavior, or if the organizational aspect changes, this may impact the process. And I was thinking about, over the last month, our organization had a huge organizational shift where we closed down a bunch of centers. I believe we were bought out by organization, and there were just like a lot of changes when it came to like utilization and BCBA hours and just like different things that the organization is wanting to change, primarily due to financial reasons. And in this example, I see how everything is interconnected, and you can't necessarily change one without it impacting the other, right? So for example, Georgia Medicaid just released a new standard where BCBA notes also need to be signed by parents. So this seems like a simple, 1-2 fix, and we could just have parents sign notes. But we also have to think about many BCBAs are remote or travel. So how do we get these signatures, in a smooth and practical way? So we then had to connect with Rethink, who's our EMR provider, and figure out how we can expedite this process for parents to make sure that we can convert our sessions. Because if we don't convert our sessions, then we can't bill to insurance. So the individual behavior, so the individual performance of the BCBAs will then impact the overall systems process of completing and converting, session notes so we can submit it to funders. And if there's a delay in that, or any errors in that, this then impacts the organization, because now we don't get the reimbursement rates that we need, or we just don't get reimbursed at all because we don't have those signatures. And then that obviously impacts the financial state of the organization, then trickling back down to the individual impact, right? So BCBA salaries, RPT salaries, OM salaries. So it's just important for us to look at this from a comprehensive perspective, because everything is interconnected. So when one thing changes, we have to kind of think, how is this going to impact the other parts of this process? One thing my classmate mentioned was that OBM itself is kind of underdeveloped, which I didn't really see it that way until we kind of dove deeper into the literature. And if we think about it, like ABA itself is a new field, and since OBM branches from ABA, right? Like ABA is the foundation of OBM. OBM is kind of new compared to ABA. So looking at kind of the jargon that we have in ABA, right? Like my classmate says, like, we have a lot of jargon that's like specific to our field. So it kind of in a sense makes us a little bit more established. But OBM, they kind of piggyback off of a lot of the jargon that we're using in ABA, and that's not necessarily a bad thing, but the question is, how does OBM become more distinctive? Because in ABA we see the utility in OBM, but looking at organizations who don't know anything about ABA and behavior analysis and what this means, how do we get them to adopt the OBM practices? Because at the end of the day, it's for organizations, right? Like, that's who OBM is for. And if organizations aren't understanding or wanting to adopt these practices, then the field isn't doing the work that it's intended to do. And looking at some of the jargon that's used across the field, or even like some of the things that we've been learning about, kind of mimic what we've been doing in ABA. So like the PIC, NIC, right? So we look at positive and negative, and then the immediacy of the consequence, and then is it certain or not certain, right? So even looking at like the experimental analysis of behavior, when we look at things like delayed discounting, when the reinforcer is delayed, this may reduce the motivation, right? Or even like the matching law, when reinforcement is allocated more so to one side, then the behavior is more likely to be occurring towards that mathematical equation, towards the side that has the most reinforcement. So that kind of goes along the lines of like the PIC and NIC phenomenon. So I think with OBM in general, as the field grows and expands, it'll be helpful for them to create like more of an establishment of their own principles and backings, even maybe some outside of ABA, since ABA is already a pretty controversial field. By not having their own practices or ideologies, this may hinder organizations from wanting to pick them up and kind of adopt them, because it's so rooted in ABA, and which is a field that is already kind of controversial or growing in itself.